ICU beds in Mississippi are full. Doctors are turning away transfer patients. One hospital describing its staff as stretched thin, exhausted, and running on fumes. Meanwhile, doctors are worried that Mississippi residents still are not taking the coronavirus seriously.
Please don't make this worse for us. And I think that there's that group of people in Mississippi, maybe with the mask mandate that just went into effect yesterday, will start to be more serious about it. But there's a big group of people in Mississippi who just, their lives have not changed at all.
NBC News correspondent Ellison Barber outside the University of Mississippi Medical Center in Jackson. Ellison, the doctor you spoke with says her staff is just exhausted. What is happening at that hospital today?
Yeah, just if you hear some of the noise, we are just seeing a helicopter come in and land on top of this hospital. A reminder, the loud noise, a reminder of how important this hospital is, not just for people who live in the area of Jackson, but really the entire state. The University of Mississippi's Medical Center is the only hospital in the state of Mississippi with level 1 trauma care. They are the only hospital in this state that does transplants. Right now, with all of the COVID cases, they are overwhelmed, overburdened. Their ICUs, according to doctors we have spoken to, they aren't just full, they actually have a deficit. They have more people waiting for ICU beds than ICU beds they have. Really quick, I do want to show you on the hospital here. If you look in the windows there behind me, each of those windows, you see those silver things, those are ICU rooms that have been converted to negative pressure so that they can treat patients with COVID-19 and safely keep that air from going into other parts of the hospital. This hospital started making those changes to those rooms in April. This is a fight, a battle that they are still very much in the middle of. If we walk a little this way, I want to introduce you to one of the doctors here. This is Dr. Alan Jones. He is the clinical director at this hospital, also an emergency room physician. Dr. Jones, thank you for coming out here. I know you have been inside working all day today. Can you just give us a sense of what things are like inside your hospital right now?
Well, it's pretty hectic. Lots of patients. Coronavirus really just makes everything much more complicated. Even patients that present without the typical symptoms we have to be concerned about. It makes the ability to care for the patients more difficult, more meticulous, and it just wears the staff out having to do this day after day.
What are your other doctors, nurses telling you as they are dealing with this? I mean, I understand you guys have been pretty stretched, not just for a couple days, but for quite a few weeks now. How are they holding up and how are they managing to push through? When you look at Mississippi statewide, and you guys already don't have a whole lot of physicians here, you have the lowest amount of physicians per capita compared to all the other states. How do you balance that with the need, and how do they maintain kind of their emotional composure through all this?
Yeah, well, it's hard. I mean, you know, we started this in March. We kind of were running a race, getting prepared for everything. We had a little bit of a lull, and then pretty much a steady uphill climb since then. And it takes a toll physically, emotionally. I think the most difficult thing is that we feel like we're running a marathon with no finish line in sight, or every time we think we see one, it disappears. You know, the thing we're worried the most about is our staff. Our nurses are tired, our physicians are tired. It takes a lot out of you to deal with this day after day. And, you know, to think about how the lag between case positivity and then hospitalizations and then death, we know that there's probably a 6 to 8 week window where all those follow each other. It's just exhausting. And the thing that we worry the most about is just our staff's resilience.
What do you need people to do to help you right now?
Well, really, we need people in Mississippi to stay inside, stay away from each other, stay out of bars and restaurants and gyms, wear a mask, keep away from each other, and really try to do their part. We've heard it said, and I think it's really the correct thing, and that is we're the last line of defense. They're the first line of defense. If they do what they need to do, they never even see us. So really listen to these things and try to take them to heart.
Thank you, Dr. Jones. And Allison, the soundbite you played just a minute ago from Dr. LOUANN Woodward, when I was talking to her yesterday, she said one of the things that keeps her up at night right now is PPE. She said they have enough protective equipment for their doctors and nurses right now and for tomorrow, but what she's worried about is what happens come regular flu season when they get to October. She says right now They are preserving some N95 masks so they can sanitize them in the event they need to tap into that extra stash. She says she hopes it doesn't get to that point. But that's one other thing that as they're trying to look ahead into what Dr. Jones said, the idea that there's not a clear finish line here where they're trying to stay on their toes.
Yeah.
But there are a lot of different factors and a lot of evolving things every day. And you look at just the cases right now. I mean, Mississippi, there's only 2.9 million people living in this state. They have one of the highest per capita death rates right now, and their per capita new infection rates put them kind of in the same category as Florida. Allison?
Wow. And from everything we've heard, Ellison, it does not sound like things are going to get any easier as we head into fall. Thanks to you, and our thanks to Dr. Jones and all of the doctors there who are just working so hard to keep people alive and keep them healthy. Thank you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.